Are out about the coronavirus that's sweeping through parts of China, sickening hundreds of people, and it has killed at least 6. Now, currently no cases found in the United States, but CDC officials are not taking any chances, screening passengers now coming in from China at major international airports such as New York, Los Angeles, and San Francisco. Our question is, could Dulles be added to that list? And what is the coronavirus, and how is it spread? Can it be prevented? We have a lot of questions for infectious disease expert Dr. Amesh Adalja, who joins us live this morning with the information that we hopefully will learn about. Good to see you, Doctor. Thanks for joining us. The first question that I have is we hear about these airports and screening in New York and Los Angeles, San Francisco. Do we need to worry about doing this in Washington?
You have to remember that the first airports that the CDC decided to screen for this novel virus had direct connections to the epicenter of the outbreak in Wuhan, China. So we have direct flights that land in JFK and in San Francisco, and an indirect flight that gets to Los Angeles. So that's where the CDC thought the most likely place you would capture someone from that outbreak area would be found. If this does spread to other parts of China, and there certainly are flights that go directly from Dulles to parts of China, you may see that change. But right now, Wuhan really seems to be the center of this outbreak and where the cases are originating.
You know, I think that without having the medical expertise that you have, a lot of people hear about something like this, a contagious virus from overseas, and you think about maybe SARS or MERS or something that got a lot of attention in the past. How does this compare?
This is from the same viral family as SARS and MERS, so that really got everybody on high alert when this new virus was discovered. However, what we're seeing is that this doesn't seem to be, at least now, as deadly as SARS or MERS. This has only resulted in 4 deaths so far, whereas SARS was something that was much more deadly and spread 8,000 cases over the world with about 800 deaths. And MERS has a case fatality rate of about 35%. So we're not seeing that type of severity with this coronavirus, but we don't really know that much. This is very early days, and things may change as we get more information.
So what's the next step when you have something like this that's a person-to-person type virus? You know, you're waiting on the information, but is it essentially waiting to see if more people are impacted by this?
Really what we're trying to find out is what's going on the ground in Wuhan. What are those cases like? What are they requiring in the hospital? How are they transmitting the number of cases that are transmitting? How frequent does that happen? Is it a rare occurrence? Is it very common? There's a lot of that needs to be found out before you can actually formulate a really exact plan to contain it. And tomorrow the WHO is going to be having an emergency meeting to discuss this. And I think those questions will be the ones that are the most pressing to answer so we can gauge the severity of this outbreak and its risk.
So obviously it's getting a lot of attention here in Washington as it is around the world as a headline. People not necessarily freaking out now, but we did hear from some parents who, had some kids coming in from China, landed in Dulles in the last day or so, and they were quite honestly concerned a little bit, just in case, being precautionary. Are there any symptoms or anything that would stand out other than something that might be a perhaps more normal type of cold or illness?
No, this is going to be very hard to distinguish from a common cold, and in fact, causes about 1/4 of the cases of a common cold. So this is something that has very symptoms that very much overlap with the cold and the flu, and we're in the middle of flu season, so it's going to be very hard to distinguish these types of cases. And that's why travel history is really important. And we also need to know the severity, because if this is tending more towards a common cold type of coronavirus, there's less concern versus it being more like a SARS or MERS coronavirus.
Understood. All right. Parting words now. I'll just ask you then, for folks who might have some concern here, maybe they have loved ones who are traveling or plan to travel internationally at some point soon, or they're welcoming someone back home. Any final words of advice for them?
The CDC has not issued any specific travel restrictions, and travel restrictions don't usually work very well during outbreaks. But what they are recommending is people be alert and practice the usual precautions when you go to China. So that may mean avoiding sick people, avoiding healthcare facilities if you can, and also avoiding the live markets, because the initial cases were centered around a live market in Wuhan. And we may find out that was kind of a red herring, or it may actually have been in the epicenter of the outbreak. But for now, we should avoid those kind of live markets in parts of China.
Sure, and we've seen this in the past where it's transmitted from animal to human, so hopefully it's not a repeat of that behavior. Dr. Adalja, I really appreciate your time this morning. Thanks so much for joining us.